friends, and welcome to the October 29th edition of Weekly Witness, Texas Impact's weekly opportunity for mainstream Texans of faith to learn about public policy issues here in the great state of Texas and have a conversation about how you can engage in the process. My name is Scott Atnip, your host and Texas Impact's Outreach Director, and this is our fifth and final episode in our special Weekly Witness series, Gearing Up Texas Impact Faith Priorities for the 2021 legislative session. And today we're going to be talking about the final piece in Texas Impact's 4 priority sections. We're going to be talking about economic justice, and I'm really excited for the panel that we have lined up for you today. But before we jump in, a couple of quick housekeeping items. And y'all, really today, it's all about voting. You know, people talk about Election Day being next Tuesday, but Texas is already setting record numbers for turnout. So I would argue that Election Day is here and we're waiting for the votes to be finalized. So I've enjoyed seeing your I voted stickers. I've been amazed at the way Texans of faith have responded to this election season. And I assume that if you're listening to this podcast, either one, you've already voted, or 2, you have a solid plan for when and how you're planning to do that. But just because you voted doesn't mean that the process is over. Our expectation, our hope, is that you will be contacting everybody in your network who might need a little extra nudge to vote, and that you're asking them how, when, and how they plan on voting, and that you follow up with them again to make sure that they actually did so. 2, we've been talking for months about the importance of participating in this election. And if you're listening live, we have a couple of different options for you to consider. First, we've been talking about poll monitors. I think there's still one more training for those if you're interested. We also announced in our e-news yesterday, and there's more information on our Texas Impact Facebook feed, that we are recruiting people to participate in a de-escalation training that's scheduled for tonight at 5 o'clock. So if you're listening live on Thursday, check out the Facebook page, check out the e-news, and consider participating in that. You can find out more and see all of our wonderful resources about election 2020 on our Texas Faith Votes page. Go to texasimpact.org, click on Texas Faith Votes, or if you have questions, you can email me directly at scott@texasimpact.org. And y'all, I don't know what else to say. I was trying to put together an email the other day, and I have just run out of words for what to say about how important it is that Texans of faith engage. I'm really excited about the way you've done that, but at this point, just do it, right? To borrow a slogan. Do it, drag your friends, participate in the process. We need everybody to be active and engaged for a few more days. And then we'll wait and we'll make sure that every vote is counted. And we'll keep you up to date in terms of if there are any action steps you can take. But after all that is over, I'm going to give everybody a chance to take a couple of days to breathe and relax. And then we'll launch back in to prepare for the 2021 Texas legislative session. And our hope is that this podcast series will help you do just that. So one final word, since we do have some folks who are joining us live, I'm sure everybody's used Zoom by now, but we're going to treat the chat section as kind of water cooler talk, where you can talk to either the panelists or other attendees. I would encourage you to check the other attendees box. But if you have questions specifically for the panel, please drop those in the Q&A section. So with that, I am excited to welcome our panel today. Joining us for the final episode of this series, we have our Executive Director, B. Moorhead. B, thank you so much for being with us again.
Thank you for having me again.
We have with us one of our board members, Annaliese Cothron. Annaliese, thanks so much for the time.
Hi, everybody. Excited to be here.
And last but not least, we have Bishop Mike McKee from the North Texas Annual Conference of the United Methodist Church. Bishop McKee, thanks for the time.
Glad to be with you this afternoon.
All right, and I appreciate you all. We're going to start out with B this afternoon, though. And B, we've worked together for years, and I have heard you tell kind of your story about why you engage in this work, and economic justice seems to be kind of at the heart of why you got into public policy. So start out by telling us about our legislative priorities. What is included in this economic justice section, and why are those priorities important for Texans of faith?
Well, okay, so let me let me start, I think, by saying, hopefully you can drop this into the chat, but for people who are listening to the podcast, the legislative priorities are on our website. They are at texasimpact.org/2021-2022 legislative platform. So when people look at that, they'll see that there's a specific section on economic justice. The thing I guess I would want to start by saying is, in some ways, it's very hard to separate economic justice from all of the other kinds of issues that the faith community cares about. I think over and over again, faith communities in the United States certainly come back to this basic concern that the way that we spend our resources, the way that we get our resources, the way that we make the policy decisions that determine who will have and not have resources in their own lives, all of those things are central to all of our faith teachings. And so while we might parse out, for example, education or health as an economic justice issue, I would urge people to think that if you look a little deeper on climate justice, talking about making water available and affordable for all people, making sure that everyone is protected from loss of property in a natural disaster. When we talk about preferring or disadvantaging organizations or individuals because of their faith tradition in ways that prevent them from making a living or participating in programs. All of those things, every one of them in some way refers back to the basic idea of economic justice. Having said all that, in our legislative agenda, we've named 3 specific areas that are economic justice issues that I would say are maybe the core foundational bread and butter issues of economic justice for the broad range of faith traditions that belong to Texas Impact and that are operating in Texas and the United States. The first one is education. The second one is healthcare and health more generally. And the third is hunger and poverty. And if you look across our faith traditions, you'll see that hunger of all of them is probably the most bedrock consideration that we have. And I'm sure that Bishop McKee is going to talk about that in more depth. So for us, for Texas Impact, education generally refers to the public school system, and it generally refers to the way that we fund the public school system so that children all across the state of Texas in every kind of community and every kind of circumstance have substantially similar opportunity to get the same level of excellent public education that they need. So our 3 primary things are funding the cost of enrollment growth in the public school system. That's been just a constant point of tension for the legislature over the years. Second, opposing school vouchers or any other strategy that would divert funds that are assessed under the public school finance system to non-public education. Most of our faith traditions have very strong statements opposing vouchers. And the reason is not because they oppose the availability of religious education or secular or private education. In fact, a lot of the faith traditions that participate in Texas Impact also run their own schools. It's that we can all agree that money that comes from public funding sources that's provided by taxes shouldn't be going to support education that's not available equally to all children, that doesn't maintain that separation between religion and public purposes that we expect in this country. The third is establishing a state personal income tax to provide a stable funding base for the public education system. And I know that everyone probably thinks when Texas Impact says income tax, they think, here we go again with Texas Impact, always harping on the income tax. Texas Impact is one of 2 organizations, the other one is the League of Women Voters, that have supported a state personal income tax in Texas since 1973, when we first started saying there is not ever going to be a way to meet the needs of our growing, vibrant state without a stable, fair funding source. And income tax is the one that most states choose. It's it is mysterious how a state like Texas, that has been a leader on so many things and forward thinking on so many things, has managed to stay in essentially the revenue dark ages for so long. But hopefully we'll be able to address that one day. On healthcare, our primary issue is expanding Medicaid or some other strategy that would expanding it under the provisions of the Affordable Care Act, or if the Affordable Care Act is overturned, which we think could happen, unfortunately, because it's a good law that's helped a lot of people. But if it did, finding another way to expand Medicaid so that low income families in Texas have access to health insurance. And I brought up a statistic just so I could help us all remember that as of 2019, the latest statistics available, Texas's uninsured rate is higher than 18%. That is twice the national average, 2 times the national average. And Texas's the share of Texans who have employer-sponsored insurance is much lower than the national average. In Texas, employer-sponsored coverage simply does not cover people the way it does in other states. In addition to that, we have other health-related issues on our agenda. I won't go into every single detail of every single issue. I do want to say really quickly on the issue of hunger and poverty. This is a broad issue that it encompasses everything from streamlining and simplifying application and enrollment programs, systems for programs like SNAP or food stamps, and also unemployment insurance and all of the other kinds of supports that we provide for people when they are in situations of temporary need, to eliminating predatory practices in the lending and financial services market, and to modernizing unemployment insurance and improving access to affordable housing. So hunger and poverty, big category there. Hoping some progress on that issue this session. So I will stop there because I know that our guests have a lot to contribute.
Yeah, and we might come back to a couple of those points later in the conversation, but let's turn next to Annaliese. So Annaliese is a board member, so people know. We have 50, 60 board members who come together for a board retreat every other year to come up with these priorities that everybody can agree on. So I want to start with asking you, why are these priorities related to economic justice so important to Texans of faith? And as somebody who in your day job works in the health equity realm, how can we better understand education, health, and hunger and poverty through an equity lens?
Yeah, I think that's a great question, likely without a simple answer. So I'll try to piece through how I consider equity and why this is probably important to everybody. And you have probably vocalized at some point how important it is to you, not realizing that you're actually speaking to the point of equity. And so how I like to think about this is when we talk about health, we often deal in 2 terms. So one is a disparity and one is equity, right? And so the disparity is essentially the difference. And often we talk about a disparity in a negative way. So if I see a disparity in health, it's because one group has been disadvantaged while other groups have been advantaged. So the disparity is a cause of inequity. And equity is different than equality because equity really speaks to the ability for people to access opportunities that fit their needs. It is much more individualized, and there are probably a million different ways you can conceptualize this. One of my favorite ways to think about it is from the Robert Wood Johnson Foundation, and they like to describe it as a bicycle race. So if I ran a bicycle race against like a small child, and then my husband who's 6'1", and then perhaps somebody who uses a wheelchair, the bicycle that I'm going to need as a woman who's 5'2", maybe 5'3" if I have heels on, if I want to give myself a little nudge, versus a child's bike, versus a bike for somebody who uses a wheelchair, versus a bike for my husband who's 6'2". So if I were going to engage in equality, then I would give everybody the same bike that I'm using and be like, have fun. But that's not equity, because not everybody can use that same bike and have the opportunity to actually participate in the race to begin with, much less have a fighting chance of being successful in that race. And so what we talk about in equity is giving people what they need to be successful. And so we really talk about this upstream effect. And I know sometimes we have these really fancy words, but really upstream just means we're trying to prevent that disparity from happening to begin with by engaging in policies. So that's why these policies are so important, because they help us prevent bad things from happening. That, I mean, ideally, that's what we would like, right? Is we'd like to engage in policies that prevent these disparities from even happening. And disparities are not specific to health. They education, they poverty is a disparity, right? That is a result of inequity. So all of that to say is that health, education, the justice system, economic justice, none of these exist in silos. They are all interacting all of the time. And so it's really important for us to engage in policy measures where we're considering how these consequences and how these systems all interact. In my work, we like to talk about systems change a lot. And again, that sounds like a very fancy term, but essentially what we're saying is the education system, the economic system, the health system, the justice system, these are not working equitably. They are not giving everybody the opportunity to get what they need. And so the way to make that happen is to advance policies that can help equalize those opportunities. So that's really how we think about it. And I like to talk about health in all policies. That's an oldie but a goodie. I think that was coined in maybe the 80s or the 90s. And it's actually, you could probably extend that same reasoning to almost anything. Education in all policies, for instance. You want to fold in the thoughts of where health could fit in. When we're talking about community planning, well, health could fit in by building sidewalks. So it's just really thinking about the opportunities to keep people safe, happy, and giving them the opportunities that they need in the communities where they live. So we can talk a whole lot more about what I just said, but I think that's the simplest way to communicate what you're asking me.
Appreciate that. Thank you. Bishop McKee, turning to you. So the Texas Impact Board's only hard and fast rule on crafting our legislative agenda is that we have to have consensus or agreement on all of the agenda items, and that none of those items can conflict with national social statements of our member denominations. You have served in national leadership with the United Methodist General Board of Church and Society, and have been through a similar priority setting process before. So should it surprise listeners that all of these diverse faith traditions can agree on so many policy issues? And do these priorities line up with what you would expect people of faith to prioritize?
So I think it does surprise people. I don't think it should, but it does surprise people because we live in our silos so much of the time and think, nobody could possibly, we can't all get agreement on this. But I do think in terms of the larger faith community, I will not say all faith communities, but the larger faith community, that there's a consensus, a common agreement on those things that really matter for what I think most religious traditions point to. And that is healthy communities, people being able to make a living, just for things to be fair and equitable, not equal, but equitable. So, by the way, I finally gotten the difference between equality and equity, the difference in the last 3 or 4 weeks. I will say that we've had a significant conversation with our cabinet about those particular words as it relates around racial justice. I know that we're not talking about that today, but that's a place where it really becomes it's an easier way to think. It has become an easier way for me to think about it in that conversation. That being said, I'm not surprised. I do think that we have several things and many more things in common than things that divide us. And I understand that. And so I'm not surprised, but I understand why people are.
So this question might be for B, but I'll open it up to others who have thoughts as well. Certainly, the Affordable Care Act has been in the news over the course of the last couple of weeks with the Supreme Court hearing coming up soon. So recognizing that the answer is dependent in large part on the election, what's the current reality of healthcare in Texas and nationwide, and what should people be watching for over the course of the next few weeks?
I think I'd like to start it off by echoing what B said very briefly, which is, B brought up these numbers, but I think what people can recite to their legislators and other elected officials is that Texas is the #1 state that lacks insurance. We have the highest number of people and highest proportion of our population that lack basic health insurance. And that doesn't talk about dental insurance or vision insurance and all of these other pieces of our health. They're not different. They're not off of our bodies. They are still a part of our bodies and affect our health. And so when we talk about disparity, particularly in light of the pandemic, when we already have such a profound gap, and then we know that COVID-19 has decreased the number of people working, decreased the number of employer-based or employer-paid health insurance. That result that we're seeing is only exacerbated. So in that context, I think that it's a huge talking point for us to talk about Medicaid expansion and the needs that we need to see there. And I know that those conversations have been happening for years, but I think people have a real appetite for saying, I'm so sick and tired of being sick and tired. I need Texas. I need the people that I voted for and I am paying with my taxes. I need them to take care of me now. So I think that's the real undercurrent here is we're asking for help and things have gotten worse and we have an opportunity. So we should step up legislatively to that point.
Well, I want to dig on this a little bit. So when we say Texas has the highest percentage and the highest number of people who are uninsured, in any given year, that would be interesting. But here's the reality. I started working on health policy in 1991. And at that point, one of my classmates or not classmate, but schoolmate, who was a few years ahead of me, Ann Dunkelberg, had been working for about 5 years on healthcare. And she had already written a report called Rising Costs and Declining Access. So this would have been in the late 1980s that she had written this report that was, at that time, people said, oh dear, this is kind of a disturbing report.
She froze.
80s, going ahead as a real, a real star in a bad way, like a real bad actor on health insurance. So already, by the time, I don't know, you guys were little at that point. In the course of time since then, there has never been a year when Texas wasn't the worst. That entire time, for the past, whatever that is, 30 years now, Texas is always the worst one. And there are reasons that that's true. And some of them we can identify as being, systemic racism. And some of them we can identify as, I want to talk about, though, there is a really macro concern, which is our state is big enough that it kind of operates as 3 different populations. One of them is our increasingly sort of urban and north of I-10 population, where people, if you look in a city like Dallas, yeah, the uninsured rate is still bad, but it is not as off the charts as it is in if you look at the state as a whole. In rural areas, uninsurance is worse, but the biggest problem isn't even uninsurance. It's that the number of people who have insurance compared to the number of people who don't have insurance isn't enough to sustain a functioning system. So the reason rural hospitals are closing is the local economy just can't support a hospital. The third is the big area south of I-10 where, I mean, Texas Impact has done for relatively recent reports where we analyzed uninsured numbers for just the county south of I-10. It's not that we have low rates of employer sponsored coverage. It's that almost no one has employer sponsored coverage. And it's worse if you look at employers who aren't public sector employers. So in far South Texas, it's highly unlikely that you would have employer sponsored coverage unless you work for a government agency. We're not, as a state, since the late 80s, when these trends started to become really apparent, we haven't done anything but get worse. We haven't done anything but exacerbate the disparity between those three groups. And it's not just going to be a question of putting Medicaid expansion in place, although I think that's really important and we need to do it. It's that as an entire state, we need to look at ourselves holistically and talk about, are we ever going to be able to make progress on hunger, poverty, climate, disaster, education, workforce development, any of those things, if we can't kind of bring ourselves back together and acknowledge that every single Texan needs access to healthcare?
So I want to answer this and say, I think, and from where I'm coming from, that's the most critical issue facing us because everything else falls from that. So when we think about healthcare, I don't. So when I was working on a committee in Tarrant County related to the accessibility of healthcare for John Peter Smith at the county hospital. So one of the things that became clear is, and I think this may have come up in a conversation with Ron Anderson, who was then the CEO at Parkland, and he said to me, he said, we cannot be an economically healthy community unless we are physically and mentally healthy. So we think that this really doesn't matter, but our economies in the state of Texas, all over the state, would go upward if we had a healthier population, which means having access to healthcare. So Medicaid expansion becomes one of the ways to do that. There's no doubt about that. But if I were to take anybody on this call, through a tour of emergency rooms in Dallas, Texas tonight, I can assure you that too many of those people have no health insurance. And they don't belong in that emergency room, but it's the only place where they can get health care. Now, there's some hospital systems, Methodist Hospital being one of them in Dallas, that has other ways in which to access care like that. But friends, every time somebody goes to an emergency room for strep throat, somebody's got to pay for it. And while we may think this is a cost to us, if we provide adequate health care for everybody, the long-term cost on not doing that, I don't have the study on that, but is a lot more than this. So you have children who are not able to go to school because they're sick, or children who are a working mom, or two-income earners who really realize if they don't go to work, things can't get better for them, but they're sick, and so that prevents them from going to work. It just decimates the family in so many ways in terms of equity, health, education, any number of things. And so I do think this is the crowning one of the pieces got to do. If the ACA is, God forbid, is taken apart by the Supreme Court, then you're going to see a collapse of the health system all across this country, because it is not wired to be able to handle that many people on that kind of thing. Now, everybody's going to say, well, if everybody has access, then it can't handle that. Well, it can handle a lot more healthy people. They can handle a lot of ill, sick people. So if the ACA, I'm still waiting for the plan from the current administration on what healthcare is, other than to destroy what's happening now. I'm sorry if that's a political statement. That's exactly what's happening. You don't see a plan other than drug prices are lower. They're not. But what I'm saying is this is going to be the demise of the economic system in our state if we don't address this healthcare. The second piece about this healthcare that's really important are the homeless And number three, and the third that involves this is mental health capacity. There is not enough mental health capacity in the state of Texas, and that's why we see so many homeless people. This is something that concerns, I know, the hospital systems in the Dallas area. I don't want to speak for any of them individually or collectively, but it is a big concern about adequate resources for mental health. Like okay, let's go ahead, and I'd want to say to everybody on this call, I don't know if there are that many, but we ought to literally be in our legislators every day of the week on this issue of healthcare. Because if the ACA collapses, Texas is going to be in the worst trouble of anybody. It'll be decimating. And you've got to remember, if kids are sick all the time, they're not learning. And if they're not learning, they do not become as productive as they could be. And so we keep kicking this can down the road so that our grandchildren, our great grandchildren are going to have to find a way to fix something that should not have to be fixed.
Bishop, I hope you're not holding your breath for the plan to come out. I would worry about you.
No, Scott, I'm much smarter than that.
Well, I want to take it back to one of the questions or one of the statements you made in your first set of remarks. And that's this idea of racial justice and equity, because one of the things that I remember so clearly about a series of conversations we had this summer on the podcast about racial justice was I asked each set of panelists, where would you start to address racial inequity? And like the answers were all over the map. But one of the things that people kept coming back to is that they start with healthcare. Right, that out of all of the different ways that we could address racial justice in the country, that healthcare was one of the key areas that folks thought we should focus on. So I wonder if anybody has anything kind of add on this. This isn't just an economic piece, but it's our current healthcare system is furthering racial inequity in the United States, and especially in Texas during a pandemic. So
well, I mean, I'll start and I'll say, yeah, I mean, that's kind of what we've all been going around is health is so central to all of the other things that it's almost like a shortcut to generate inequity if you don't provide it, right? So the way that we have it right now, there was a bishop in the mid 80s, Bishop Flores, who was a Catholic bishop in South Texas in Brownsville, and he made a speech about healthcare and he's the plight of people down there, and he said, for some of us, the sicker we get, the poorer we get, and the poorer we get, the sicker we get, and that's a rut that you can't get out of. Well, where we are right now, nationally and for sure in Texas, is that we've created, I mean, you know what, think about a rut, right? You know what it's like if you spin your wheels so much, eventually, it would take someone affirmatively coming and pushing to get you out. The state, as a state, is going to have to decide that it wants in one go to make a move that will push us out of that rut. And if we did, then yeah, I think you would see all of the other metrics move. But if we don't, it's going to be hard to make moves on any of the other ones.
It creates a better playing field for the ultimate improvement of all the other metrics.
Yeah, and so I've been doing a lot of, I've been attending conferences, I've been attending workshops, we've certainly been promoting them within my organization, the American Institute of Dental Public Health. And racial equity, I'm so happy that there has been a reckoning in this area. And at the same time, I just, on the other hand, feel such a deep sadness that it's taken so long for white people to admit that other people that are not white matter in this world. And so as the gatekeepers and the perpetuators of white supremacy, I can tell you that the system is working exactly how we designed it to work. We designed these systems to benefit us and create differing opportunities for people of color. So I think the argument here is I think the systems are working how we wanted them to work when we created them. And so, in that same hand, it is now up to us collectively as decision makers, as legislators, and as constituents and community members to dismantle those systems of oppression that continue to create these disparate outcomes. But I also think there's a different lens from which that I've begun to look at things too. And I can share with you a story of just my own experience recently with some data that I was looking at. So some of my doctoral research is in anti-racism among dental public health professionals. And so I was doing some literature reviews for my research as I was going through and analyzing my data. And I pulled a research article that was on how people of color experience differing care from dentists. This article looked at dentists. And they actually did a study where they took a multiracial woman. And so they, kind of photographed her looking more white and photographed her looking more black. And she had the exact same issues, like dental issues. The care plan and all of that was the exact same. It was just in one picture she was colored as more white, and one picture she was colored as more black. And so they gave these profiles of these patients to dentists and asked them what their care plan would be. And an overwhelming majority of dentists gave a more invasive care plan to the woman who was of darker color and assumed black. Right. So that was the only difference between these two women, is that one was black and one was white. And so I pulled another study about how Black women get more invasive hysterectomies. They're far more likely to get invasive care. I mean, you can really look at this with every health outcome. And it really, to me personally, I sat back as a researcher and I thought about all of the times that I analyzed data by race. And I said, oh, here is a disparate outcome. This community of color, Black or Hispanic or whatever community I'm looking at, they have more disease. They're getting more extractions or they're getting more fillings because they have more disease. And it never crossed my mind that they were actually getting prescribed more invasive care simply because of the color of their skin. So it's actually a multi-layer thing, because people of color, you can't hide that you're Black. I might be able to hide that I'm gay, or I might be able to hide that I live in a rural community, or there are all of these things that I can hide, but I can't hide my skin color. And so how people interact with me throughout the world as a person of color, even though I can't imagine what that's like, the evidence has been so clear for so long that these outcomes are perpetuated not only by systemic and institutional racism, but by our own individual biases. And that's up to us to address at the end of the day.
Thanks, Annaliese. So the next question is one I always like to ask, as our weekly witness listeners will always want to know what they should do. And I'll remind us that we are a couple of days from a national presidential election with races up and down the ballot. So I hope we can all agree that one thing people can do is vote. But we're hoping that this series will help us prepare for the Texas legislature, and there will be people listening to this podcast well after Election Day. So I hope we can focus on maybe what we do both in the next couple of days, but also post-election. What do you hope Weekly Witness listeners will do with this information that we've been talking about today?
Well, I'll start, and I bet Bishop McKee can chime in on this right away. I think and this will sound counterintuitive, because I bet that you think that I'm going to say what people need to do is talk to their legislator and tell them that they need Medicaid expansion. And for sure, that would be a good idea. But actually, what I would say is the first thing I hope everyone who listens to this podcast will do is take the time to learn about what's really going on in your community. So when Bishop McKee says, I could take you on tours of emergency rooms in Dallas, perhaps right this minute is not an ideal time to do that with the COVID, but I bet you've got some other ways you can help people learn what really is the situation, because it turns out local information is what helps legislators make really good decisions.
So, you want Annaliese, is it okay? So I've been thinking about the most important thing that's evident in Dallas right now. I mean, those things are evident and they may be the most important. But with the number of children going to school virtually, think of how many children don't have access to that. So to its credit, the Dallas business community has been very generous. It's hard to get all that stuff in place, but they've done, I would say, I commend the Dallas community, business community, along with other partners who, and I don't know a lot about it. I've just read about it. So, but who have partnered together to provide access in a number of ways in terms of hotspots or in public libraries and provide laptops and everything else. I do think that this addressing of public school funding, which the legislature dislikes doing so very much, they ought, I have another view about that. That's a story for another day. I think it's somewhat intentional. Anyway, what I'd say is that this really becomes important. We may have some new legislators, and we've got to fund public education decently, equitably in this state, because it's not. And there are a variety, who knows how to do it. But we also have to remember that the state of Texas at one time paid 70% of the cost of public education. It's now, I think, around 30. So where did that other percentage? It is then put on the local school districts. So those taxes go up. And so people get mad because their school taxes go up in any number of school districts. And they wouldn't have to go up if the state did its job. But meanwhile, then the state wants to enact measures that you cannot raise the local tax rate. So the state needs to do its work. It still has not dealt with the original lawsuits related to the funding of public education. It's still not in a good place. And to be honest, you got too many legislators who have no experience in today's world in urban school districts or rural school districts where that becomes extremely challenging. So I would begin to advocate for proper funding for the Texas public school system. I don't care if it's rural, urban, or suburban, but we've got to do better educating students. Our metrics are not great either. And you know, to be as competitive as Texans allegedly are, they're not competitive on this, and they need to get competitive, because there's going to be a day of reckoning when people go, we're not going to attract people to Texas anymore. And they're going to realize our public school system is not in good shape. And so for me, this is sort of one of the key things for this next legislative session, because I think the pandemic has exacerbated or made known so many things, but this would be one. I do think people care a lot about children. I think it's an easily lobbied deal. That's what I'm going to do.
Appreciate that. Annaliese, thoughts?
Yeah, I think Bee and Bishop McKee have really spoken to long-term, maybe the longer term than what I was thinking. So I definitely echo both of their thoughts. I'm going to just say in the short term, so like right now, number one, vote. Scott already mentioned that. We should all be out voting, and we should be voting for people and policies that focus on supporting and serving our communities. So policies that are equitable and candidates that support equitable policies. So your values as a Texan of faith, I know all of our values really unite us around love and service. And that was said in the very beginning. That's one of the reasons why I love being on Texas Impact. I'm a Unitarian Universalist, and I love interacting with all of these different faith communities because we have so much in common. I know some people want to act like we don't, but we really do. So number one, look at your values and vote based on those values, which should really be centered on equity. And then I think number two, right now, there is going to be a lot of uncertainty. I know Josh Houston from Texas Impact likes to talk about this. Right now is voting season. So we should be expecting this to take some time. And I think that's where Texans of faith come in to say, we're here to support you during this time of uncertainty, because we're not going to have all the answers that we want to have. And that often feels really frightening. So I would also just invite everybody to consider how you take care of yourself during this time. It's so easy to feel burnout. Man, I know I feel that way because we all feel so passionately about helping other people. And especially depending on how policies and legislation goes, we may feel super defeated. And so I would just invite everybody to take care of yourself and take care of your community at this time, and also to stay engaged with Texas Impact. I know as a board member, it's so critical. Texas Impact feels like a lifeline right now. As we move into this legislative session, Texas Impact gives me rapid response alerts so that if I know like there's something that they need me to do based on my geographic location, based on my specific expertise, I know I can connect with Texas Impact. And Texas Impact connected me to poll monitoring. So I've never done any sort of election protection or election support before. And this was the first year that I felt very compelled to do that. And Texas Impact was able to facilitate me being a poll monitor. So I'm very excited about the opportunities, but I recognize that the work isn't over, and the best place to continue to figure out where you can be engaged and where you can be most effective is to stay connected to your community and organizations like Texas Impact who can give you the tools that you need to do so.
Right, there's a good board member right there. Thanks, Annaliese. And I'll echo some of that, and then I'll give everybody a chance to kind of give us some closing thoughts or shameless plugs. B talked about, and we were talking actually before everybody else got on today, that we've all kind of been pointing towards election day, like especially those of us who work in the advocacy realm, like we'll be finished on election day, right? But this year, you know, the media is talking about, everybody's talking about, it's going to take longer this year to process votes because of so many coming in through the mail and all of those different issues. So Texans Faith really can lead in encouraging people to be patient, to take the time necessary, and to make sure that every vote is counted. And I do think, to Annaliese's point, it is important that we take care of ourselves, that we get some rest and exercise, and prepare ourselves for what might be, you know, more than a couple of days of ensuring this process is done properly. And we have so many poll monitors and election workers out there who will be able to tell stories about how that process worked. And so we're looking forward to hearing from them. But any closing thoughts or shameless plugs that any of you would like to make before we close out today? B, I guess we'll start with you.
I would just, the shameless plug I want to make is that in the midst of all the policy stuff that we're talking about, it's important for faith communities to stay grounded in why they care about the issues they care about, and to keep bringing it back to their faith and their religious teachings. And Texas has just released 2 new liturgical guides that are full of information to help local congregations do that. One of them is called Heal, and it's about healthcare. The other one is called Safe, and it's about immigration and refugees. And in both of them, you know, you'll find lots of stuff: sermon starters, scripture, suggested hymns, some litanies and prayers. They are there's some of the content's Christian, some of it is not. So I would just encourage people to go to our website, to the resources section, and check out those liturgical guides, just as a way to remind ourselves that the reason that we care about this stuff is not just secular political interest. We have deep spiritual reasons for caring.
And Annaliese, you kind of gave us some closing thoughts and plugs a second ago, but anything else you'd like to add?
Yeah, I think I gave my my huge plug for Texas Impact and how passionate I am about the work that we all do. And I will say, you know, in terms of health equity, if you are interested in learning more about health equity, or specifically oral health equity, I will plug my own organization, the American Institute of Dental Public Health. And I am also a board member for the Texas Oral Health Coalition. So if you're interested in learning more about how oral health can be deepened, expanded in the infrastructure, especially as it relates to Medicaid and health, then I would just plug those organizations too, and encourage everybody to vote with equity, with an equity mindset.
All right, Bishop McKee, would you like to close us out?
So I would encourage everyone on the call to get familiar with where your own traditions stand on a lot of these issues, and sometimes they might not be exactly where you are. So I look at it as a whole package, and not necessarily that I've got to agree with everything, although I mostly do. I want to be honest about that. The other thing is we've all encouraged everybody to go vote, but there's going to be another election another day. and they're going to be next spring. They're going to be all through the year next year in terms of, city council elections or anything else. So we generally think that voting comes around every 4 years, but it is a lifetime. And it's the way in which we build some synergy around the issues that are important to us. And so we can't think about them just, during presidential election times, because the other elections, in terms of the midterms or in terms of state elections, well, they come at the midterm times too. Those are all important. Well, and so we've got to. So even though we may fall a little short this time, we could be gaining ground every time. And so this is not like change is going to come overnight, but it's the way in which we build on it. And so we need to remember that and to find allies, people who could be allies, and help them understand it. So that's what I have to offer today.
It has been exciting watching the long lines and the record turnout here in Texas, and being a part of a national conversation about the records we're setting. It sure would be great if we did that, for every race.
I have one prediction to make.
Prediction time.
And it's not about who's going to win. I do not think it's going to take as long as people say to count these votes.
We've
Your
already
lips to God's ears.
I'm going to tell you. So I think that's a political ploy. And so I know that we voted by mail. I know exactly how Dallas County is handling those. For example, they're opening it, verifying that John and I are the ones who voted, putting them aside. On election day, they run them through the scanner. So they're doing all that pre-work ahead of time in a lot of these places. So I think that that's a ruse. But I still think you ought to go out and vote today if you can.
We've been having that conversation in a group text in the office, and I will say some are more pessimistic about how long it will take, and I have maybe been one on the more optimistic end. But regardless, we should be prepared for it to take some time, right? Regardless of what our predictions are, just in case.
Yeah, I hope to celebrate on Tuesday night and not Wednesday morning.
All right, we'll all be calling Bishop McKee late Tuesday night and seeing how he's feeling. All right, well, I really do appreciate all of you taking the time today. We'll settle up on predictions next week, but really do appreciate y'all taking the time, and more than the time today, really appreciate the work each of you do to make Texas a better place for those who are struggling, making our communities better places. So want to thank you all. Want to thank you all for tuning in and watching today. Remember that this work is supported by members like you. So if you appreciate the work of Texas Impact of the Weekly Witness community, please make sure that you and your congregation are members by going to texasimpact.org/join. Y'all, this might be the last time I talk to y'all in this format pre-election. So make sure you vote, and we'll look forward to seeing your I voted pictures. We'll be looking forward to seeing all of the ways that you participated, and post-election, we'll wrap up and we'll start preparing for the Texas legislature. Y'all, these are anxious times. I know people are nervous. People are fearful a lot of times. But in these moments, more than ever, the world needs the Texas faith community active and engaged. So let's get to work. Thanks, friends.